Hello everyone, this is Dr. Thong. I'm 65 years old. Today, we're going to talk about something incredibly serious, something that strikes without warning and can change a life or end it in mere moments. I'm talking about a stroke. Every year, millions of lives are impacted by strokes, and for many, the outcome hinges on what happens in those critical first minutes. The statistics are sobering. A stroke occurs every 40 seconds in the United States, and someone dies from a stroke every 3.5 minutes. It is a leading cause of long-term disability and, tragically, a preventable cause of death if immediate action is taken. Imagine this. You're having a normal day. Perhaps your loved one is laughing, talking, enjoying a meal. The sun is shining, the birds are singing, a perfect, ordinary moment. And then, suddenly, something feels off. A sudden weakness in their arm, a slurred word that makes no sense, a strange numbness on one side of their face. In that instant, panic can set in. Your mind races. What's happening? Is this serious? What do I do? It's terrifying, I know. I've seen this countless times in my decades of practice, witnessing the initial shock on faces, and I've heard the heart-wrenching stories from families who, in hindsight, wish they knew what to do. They often tell me, if only I had known the signs, or I froze, I didn't know what to do. But here's the crucial truth I want you to grasp today. You are not helpless in this situation. Your quick thinking and immediate action can make all the difference. It can literally be the difference between a full recovery and severe lifelong disability, or even between life and death. This isn't an exaggeration. The window for effective medical intervention for stroke is incredibly narrow. Every second counts. Today, as Dr. Thong, I'm going to arm you with 5 simple yet absolutely life-saving steps you must take when you suspect a loved one is having a stroke. These are the same steps I've taught my own family, and they are vital for every household. This isn't just medical advice, it's a guide to becoming a true first responder for those you care about most. The problem: recognizing the deceptive nature of stroke symptoms and the cost of delay. A stroke happens when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Brain cells begin to die in minutes. This is why time is brain. Literally, for every minute a stroke goes untreated, approximately 1.9 million brain cells are lost. This isn't just about physical impairment. It can affect personality, cognitive function, and even memory. The problem is, stroke symptoms can be incredibly deceptive. They can come on suddenly and be easy to dismiss as something minor, or they can be confused with other, less serious conditions like fatigue, a clumsy moment, or just feeling under the weather. Think of Mr. Tanaka, a patient of mine, a vibrant 72-year-old active in his community. One morning, his wife noticed his speech seemed a little off, just a slight slurring, almost like he was tired or had too much to drink. She almost brushed it off, thinking he hadn't had enough sleep or was just groggy. But then she remembered hearing something about stroke signs on a news report. She hesitated for only a moment, filled with fear and uncertainty, then decided to act and called 911. That brief hesitation, even brief, felt like an eternity to her later. But her decision ultimately saved him from far worse. Because of her quick action, he received clot-busting medication within the critical window and made a remarkable recovery. Or consider Mrs. Sato, 68, an avid gardener. She suddenly felt her left arm go completely numb while watching TV. She thought she'd just slept on it funny, or perhaps it was a pinch nerve from bending over in the garden. The numbness came and went a few times over the course of the morning, so she didn't think much of it. She even tried to shake it off. But hours later, the numbness returned with a vengeance, accompanied by dizziness and difficulty walking, and by then, the damage was far more extensive. By the time she reached the hospital, the window for certain critical treatments had passed, leading to long-term weakness on her left side. These stories are heartbreakingly common. People don't always recognize the signs, or they delay seeking help, thinking it will pass or that it's just a temporary inconvenience. But with a stroke, there is no wait and see. The brain is under attack, and the longer it's deprived of blood, the more brain cells die, leading to irreversible damage. Introducing the FAST method and beyond, your action plan. So, what exactly do you do in those terrifying, high-stakes moments? The medical community has developed a simple, easy-to-remember acronym that has been instrumental in saving countless lives: FAST. This is your first line of defense, a quick checklist to help you identify the most common stroke symptoms with remarkable accuracy. It's designed to be simple enough to remember even when you're under immense stress. But simply identifying the signs isn't enough. Beyond just recognizing, we need to know what to do after that critical identification. My decades of experience have taught me that quick identification must be followed by precise, immediate action. That's why I've condensed all this vital knowledge, combining the FAST method with the latest medical guidelines and practical wisdom into 5 critical, life-saving steps. These steps aren't just about making a phone call. They're about ensuring your loved one has the absolute best possible chance for recovery before medical professionals even arrive. They are about managing the situation safely, providing crucial comfort, and meticulously preparing for the next, equally crucial phase of emergency medical care. These 5 steps are simple enough for anyone to commit to memory, even under the immense pressure of an emergency. They are specifically designed to minimize brain damage by reducing the time to treatment and to maximize the chances of a positive outcome. I have personally taught these exact steps to my own children and grandchildren, emphasizing that knowing these steps is like possessing a superpower when facing a stroke. It transforms feelings of helplessness into empowered, effective, and potentially life-saving action. Are you ready to learn how to become a true first responder and a beacon of hope for those you care about most? The 5 life-saving steps, detailed instructions, and scenarios for each. Let's dive into these absolutely crucial steps. Remember, with stroke, quick action is not just a suggestion, it's a non-negotiable imperative. Time truly is brain. Step 1. Recognize the signs. Think FAST. Fast o ishikisuru, FAST o ishikisuru. This is your first, most vital step. Do not second-guess yourself, and do not delay. If you observe any of these signs, even if they seem minor or disappear quickly, act immediately. F is for face drooping. Kao no yugami. This is often one of the most noticeable signs. Ask the person to smile. Does one side of their face droop or feel numb? Is their smile uneven, perhaps with one corner of the mouth hanging down? Pay close attention to subtle differences. Sometimes it's not immediately obvious. Scenario example. Imagine your spouse tries to smile at you, but you notice one corner of their mouth isn't moving, or their eyelid seems a little lower on one side. This is a red flag. A is for arm weakness, ude no datsuryoku. Ask the person to raise both arms up in front of them, palms up, and hold them there for about 10 seconds. Does one arm drift downward? Do they have trouble raising one arm fully, or does it feel heavier than the other? Sometimes they might not be able to raise it at all. Scenario example. You ask your parent to show you their new watch, and they try to lift both arms, but one arm lags behind, feels like dead weight, or just falls. S is for speech difficulty, kotoba no shogai. This can manifest in several ways. Ask the person to repeat a simple sentence, like "the sky is blue" or "birds fly in the sky." Is their speech slurred, strange, garbled, or difficult to understand? Do they seem confused when you ask them to speak? Do they struggle to find the right words or make sense of what you're saying? Scenario example. Your friend tries to order coffee, but their words come out jumbled, or they suddenly can't complete a sentence they just started. T is for time to call 911, Kinkyu denwa no jikan. If any of these signs are present, even if they appear for only a few moments and then seem to go away, you must call 911 or your local emergency number like 999 in the UK or 119 in Japan. This is not a drill. This is not a time to wait and see if symptoms resolve. Dr. Thon's Masato anecdote. I vividly remember a patient, Mr. Ito, a retired teacher. His wife noticed his face droop for only about 30 seconds, then it looked normal again. She almost convinced herself it was nothing, a trick of the light. But because she had attended a community workshop where I taught the FAST method, she hesitated for a second, then trusted her gut and called 911. It turned out to be a TIA, a mini-stroke, which is a critical warning sign. Her quick call allowed him to be evaluated immediately, and he received preventative treatment that, without a doubt, every second truly counts, and even transient symptoms demand immediate attention. As soon as you suspect a stroke based on FAST, your very next action is to call 911 or your local emergency number. This is a non-negotiable step. Do not, I repeat, do not attempt to drive them to the hospital yourself. While your intention is to get them there quickly, emergency responders are equipped with specialized training and life-saving equipment that they can deploy on the way to the hospital. Furthermore, they can pre-notify the hospital, allowing the stroke team to be ready and waiting the moment your loved one arrives, saving precious, irreversible minutes. What to say? Clearly and calmly state that you suspect a stroke. Provide your exact address and any landmarks that might help them find you quickly. Stay on the line. Do not hang up until the operator tells you to. They may guide you through additional steps or ask crucial questions to relay to the paramedics. Dr. Thang's insight. Many people, out of a profound desire to help quickly, try to drive. But imagine if your loved one loses consciousness in your car or if you get stuck in unexpected traffic. The ambulance provides a controlled environment with trained personnel and specialized medical equipment, and they can communicate directly with the hospital, bypassing intake procedures. This isn't just about getting there fast, it's about getting there right with the highest level of pre-hospital care possible. This seamless transition can shave off vital minutes from the door-to-needle time for clot-busting drugs, which is crucial for a good outcome. Keep the person calm and comfortable. While you are waiting for emergency medical help to arrive, your role shifts to providing comfort and ensuring their safety. Your calm presence can be incredibly reassuring and can help prevent the situation from escalating. Loosen tight clothing. Gently loosen any tight clothing around their neck, waist, or chest. This includes ties, scarves, or tight collars to ensure clear breathing. Position them safely. If the person is conscious, help them lie down on a flat surface with their head and shoulders slightly elevated. This can reduce blood flow to the brain and may help to lower intracranial pressure. If the person is unconscious or vomiting, position them on their side, often called the recovery position. This prevents them from choking on vomit or saliva, keeping their airway clear. Reassure them. Speak in a calm, soothing voice. Tell them help is on the way and that they are safe. Avoid showing panic, as this can increase their anxiety and potentially elevate their blood pressure further, which is detrimental during a stroke. Do not give them anything to eat or drink. Their swallowing reflex may be impaired due to the stroke, leading to choking or aspiration, food or liquid entering the lungs. This includes water, pills, or any food. Dr. Thang's advice. I once witnessed a family member in a panic state, which led to the patient becoming agitated and distressed, causing their blood pressure to spike even higher. Maintaining a calm and reassuring demeanor, even when you're terrified inside, can be incredibly beneficial. Your steady presence helps stabilize their condition while waiting for the professionals. Step 4. Note the time symptoms began. 症状発現時刻を記録する. This step is often overlooked in the chaos of an emergency, but it is critically important for medical staff. When did the symptoms first appear? This exact time, or the last known normal time, is absolutely vital for doctors to determine which treatment options are available. For certain clot-busting medications, like TPA, there's a very narrow and strict time window, often 3 to 4.5 hours from symptom onset, during which they can be administered safely and effectively. Beyond this window, the risks often outweigh the benefits. If you don't know the exact time, it is crucial to note the last time the person was known to be normal and symptom-free. For example, if they went to bed at 10 p.m. feeling fine and woke up at 6 a.m. with stroke symptoms, the last known normal would be 10 p.m. This information, even if approximate, is immensely valuable. Dr. Thang's personal reflection. This is one of the most frustrating things we as medical professionals face in the emergency room. A patient comes in with clear stroke symptoms, but no one in the family knows exactly when they started. Without that crucial time, some of the most effective, potentially life-saving treatments might not be an option, simply because the treatment window has closed. Be vigilant, observe carefully, and make a mental or written note of that time or the last known normal. It's a small piece of information that carries immense weight. Step 5. Gather key information for paramedics/doctors. 救急隊員医師のための情報を準備する. Once paramedics arrive, they will be working quickly and efficiently. Having key medical information readily available will save precious time and allow them to provide the most appropriate care faster. Medications. Prepare a list of all current medications the person is taking, including the name of the drug, the dosage, and how often it's taken. Include over-the-counter drugs and supplements too. Medical conditions. List any existing health issues or chronic conditions. Example, diabetes, heart disease, high blood pressure, previous strokes or TIAs, kidney disease. Allergies. Note any known allergies to medications, foods, or environmental factors. Recent events. Mention any recent injuries, surgeries, falls, or illnesses that might be relevant. Also, if they have any known bleeding disorders or are on blood thinners, this is crucial information. Who to contact. Have names and phone numbers of emergency contacts, family members, other doctors readily available. Dr. Thang's practical tip. I always advise my patients and their families to prepare a medical information card or a simple emergency health sheet and keep it in a prominent, easily accessible place, like taped to the fridge door, in a wallet, or in a designated emergency binder. In the chaos of an emergency, every second spent searching for details is a second lost for the brain. Being prepared with this information allows the medical team to make informed decisions faster, which directly impacts the speed and effectiveness of treatment. A stroke is an emergency that demands immediate, informed, and decisive action. It's a terrifying moment for any family, but knowing and practicing these 5 life-saving steps can transform initial fear into effective, life-preserving help. Remember, recognize FAST, call 911 immediately, keep them calm and comfortable, note the exact time of symptom onset, and have all vital medical information ready. Your preparedness, your calm presence, and your swift action in those initial moments are the most powerful tools you possess in that critical, narrow time window. You, a family member, a friend, or even a bystander, have the potential to be a true hero for your loved one. This isn't just about gaining knowledge, it's about gaining the confidence to act when it matters most. It's about taking control in a situation that can feel utterly overwhelming. Please, don't just watch this video and forget it. Share it. Share it with your family, your friends, your neighbors, especially those with elderly parents or loved ones. This knowledge is too important not to spread. It's a gift of preparedness that can literally save a life, prevent severe disability, and preserve the quality of life for someone you care deeply about. Imagine the relief and gratitude if your knowledge helps someone avoid the devastating consequences of a stroke. And of course, Dr. Thang's channel is here to be your trusted companion on your journey to a healthier, longer, and more fulfilling life. We are dedicated to empowering you with practical, evidence-based, and easy-to-understand health knowledge gleaned from my many years of experience in the medical field. Don't forget to subscribe, hit that notification bell, and join our growing community of health-conscious individuals who are committed to living their best lives. Stay vigilant, stay prepared, and remember the immense power of immediate action. Your loved one's future and your peace of mind may very well depend on it. I wish you and your family all the very best in health and happiness. Thank you for joining me today. See you in the next video.